Hello, everyone, and thank you for joining us today for this special Facebook Live event to help address some of the important questions surrounding COVID-19 research, clinical trials, and vaccines within American Indian and Alaska Native communities. My name is Dr. Dave Wilson. I am a member of the Navajo Nation and the director of the NIH Tribal Health Research Office. Today, we are joined by a very special guest who really needs no introduction. Dr. Anthony Fauci, world-renowned expert on infectious diseases and the director of the National Institute on Allergy and Infectious Diseases here at the NIH. So welcome, Dr. Fauci.
Thank you, David.
Thank you for being here with us today. So since the beginning of the pandemic, the NIH has been providing information and resources to tribal nations to help them make informed decisions about what's best for their citizens and for their communities. We wanted to spend some time today addressing some important questions that we have heard from tribes across the country. Many tribal communities have shared with us that they are really at a breaking point with COVID-19. They've also shared that there's a great deal of mistrust when it comes to the federal government, clinical trials, and vaccines. And this is a mistrust that we acknowledge and respect. We aren't here to convince you today. We're here to offer clear and transparent and hopefully helpful information. At the NIH, we are truly committed to rebuilding relationships through trust with the tribal nations and tribal communities around biomedical research. With that, Dr. Fauci, let's jump into some questions that we have today. So during your extensive career, you've worked with communities around the world. Can you talk to us a little bit about why you believe tribal communities are so disproportionately affected by COVID-19?
Yes, it's very unfortunate. The tribal nations, in some respects, are similar to other minority populations throughout the country, particularly African Americans and Latinx. And the issue with regard to COVID-19 falls into two major categories, David. The first is the nature of the jobs and the occupations that one has, the living conditions that puts them into greater likelihood of contact with a respiratory-borne infection than individuals like myself who spend now a lot of time in front of a computer doing things virtually. When you're out there in the environment exposed to the virus, you have a greater likelihood of getting infected in the first place. But as important, or more importantly, that the underlying comorbidities that are more prevalent among the tribal nations are the things that are amenable, if not very likely, to give you a higher incidence of the serious consequences of getting infected. We know that a substantial proportion of people who get infected have no symptoms or relatively few. However, when you're dealing with minority populations that have underlying comorbidities that make it more likely that they will have a serious outcome, the chances of your landing up in the hospital and or dying are significantly greater among the tribal nations than among the rest of the population of the country. And I refer to diabetes, obesity, heart disease, chronic lung disease, things like that. The greater prevalence of that means you have a greater risk of a serious outcome. And that's exactly what we're seeing. Significantly more hospitalizations and significantly more deaths when you compare the tribal nations population with the rest of the United States population.
So we're hearing more and more about vaccines every day now. Can you give us a quick status update of where the COVID-19 vaccine candidates are in development?
Yes, the United States federal government, under Operation Warp Speed, has made major investments in either the development of and or the facilitation of the testing of 6 candidate vaccines representing 3 separate platforms. 5 of those 6 candidates are either in advanced phase 3 trials or have completed phase 3 trials. The 2 that have gained the most attention are the 2 that have completed phase 3 trials. The one is a product from Pfizer, which was shown in a 44,000 person randomized placebo-controlled trial, that it was safe and 94 to 95% efficacious, a strikingly positive result. That candidate has been put before the FDA to apply for an emergency use authorization, which has been granted. And just yesterday was a historic day when the first 2.9 million of now, which will ultimately be over 100 million doses, will be shipped to people at 145 locations throughout the country. The second candidate is one that's almost identical to the Pfizer product. It is made by a company called Moderna. And the type of vaccine is what we call a messenger RNA vaccine. They've completed a 30,000 person clinical trial. And 2 days from today, they will bring their data before the FDA to apply for an emergency use authorization. It is anticipated that they will be granted that. So by the beginning of next week, we will have vaccine from Moderna that will be available for distribution. So that's all good news in a record time. Something that years ago would have taken years to do was done in about 11 months.
Excellent. So with vaccines, with vaccinations starting up in the US, why are we still conducting trials to develop other vaccines?
That's a very good question, David. And the reason is we need the 6 companies to make enough vaccine to supply everyone in the United States who needs it, as well as countries throughout the world who will also need vaccines. So we don't have enough just from the 2 companies that have already shown that the vaccine is safe and efficacious. We have Janssen, J&J, we have AstraZeneca, we have Novavax, and we have Sanofi, other companies that will be conducting clinical trials.
And a lot of minority populations, including tribal nations, have expressed the concern that they don't want to be guinea pigs for COVID-19 vaccine trials. And you and I understand that they're historically where they're coming from, where these feelings are coming from. So can you address why it's so important that we conduct clinical trials in different populations?
Well, certainly. The concern is understandable, but let me tell you why it's not justified. If you say guinea pigs, that means we want to test something on you that we're afraid of testing on ourselves. And that's not the case, because the history of the vaccine trials indicate that there are many, in fact, the majority are people who are not tribal nation. There are whites, there are other ethnic and demographic groups. We want to make sure that tribal nations are represented in the clinical trials, because when the trials are shown to be safe and effective, we want to be able to tell the people of the tribal nation that we have now proven that the vaccine is safe and effective in you and in your people, so that you can feel comfortable in taking it. If you don't get involved in the clinical trial, you will not feel comfortable that what we're giving you has been proven in a scientific way to be safe and effective.
Also, Dr. Fauci, we've heard from tribal leaders a concern about how fast the vaccine trials have moved. How are we able to come this far, this fast? And why should AIN communities be confident that these vaccines will be safe?
Well, that's a good question and understandable concern. But the speed with which this has been done is a reflection of the extraordinarily amazing scientific advances that have been made in vaccine platform technologies. In addition, it's a reflection of the hundreds of millions, if not billions of dollars that have been put in by the federal government to make doses of vaccines so that they would be ready to deliver as soon as the vaccines were shown to be safe and effective. So the speed is not compromising safety, nor is it compromising scientific integrity. It is merely a reflection of very important scientific advances.
So, what we know so far, are there any concerns about any adverse effects from taking the vaccines?
Well, there are what we call early effects that are called reactogenicity, and I'll explain that in a moment. And then there are later effects that can happen. The clinical trials, as I mentioned, in 30,000 people for Moderna and in 44,000 people for Pfizer, have not shown any severe adverse events that would make you worry that you shouldn't take the vaccine. There is a relatively common occurrence of what we call reactogenicity. Namely, when you get injected, you get a transient pain in the arm, maybe some swelling, maybe some muscle aches, some malaise, occasionally fever that lasts usually from 24 to 36 hours. It can disappear spontaneously, or you can help it disappear by taking a couple of Tylenol or a similar drug. As regards to further adverse events, the FDA is not allowed to give an EUA to a company until 60 days have gone by from the time that 50% of the people in the trial have received their last dose. And since most, greater than 90% of all adverse events occur between 30 and 45 days, waiting 60 days already eliminates 95% of any of the long-term adverse events. Bottom line is that vaccines historically are among, if not the safest of the interventions to avoid infectious diseases, so that the risk-benefit ratio weighs overwhelmingly towards the benefit.
And with the current vaccines that are in production, we've heard concerns about these vaccines possibly changing our DNA. And can you please talk a little more about that?
Yeah, that is actually impossible, David. Because this is an mRNA vaccine, it has nothing to do with your DNA. What happens is that RNA is a genetic code to tell the body to make a certain protein. When you inject the RNA that codes for a particular component of the COVID-19 virus, the coronavirus, called the spike protein, you inject it into the arm and it just starts pumping out this spike protein. Your body sees it, thinks it's the virus, which it isn't. It's just a protein. It's not the virus. And it starts making a response that protects you against the virus. But it has absolutely nothing at all to do with your own DNA or your own RNA.
Great. Thank you for clearing that up. So once a person gets vaccinated, how long does it take normally for vaccines to confer protection?
Well, the vaccines that we're talking about are a prime followed by a boost, 21 or 28 days. For the Pfizer, it's 21 days. For the Moderna, it's 28 days. So if you get, for example, a vaccine on January 1st, on January 21st, you come back and get the same vaccine again. In order to get optimal protection, anywhere from 7 to 14 days following the second dose, you'll get optimal protection. You likely will get some protection after the first dose, but it won't be optimal. The optimal protection is 1 to 2 weeks following the second dose.
Great. And do we know how long after an individual is vaccinated, how long these vaccines will provide immunity? It's something that we refer to, or we heard about as referred to as durability.
David, we have to be honest, we don't know that. That's one of the things that we will find out when we follow the subjects who've been vaccinated for 1 to 2 years. The trial is aimed at a 1 to 2 year trial, as well as the people who are outside of the trial will be able to do observational studies to see how long they are protected. So bottom line is we don't know the answer. Hopefully it will be long enough to get us through a few cycles. We may, a year or 2 or 3 or more, have to boost in order to keep the level of protection up, but we're not sure of that right now.
So as we're all very aware of, our country is experiencing just phenomenal rates of infection across the country. And the question that we continue to receive is, if an individual has had COVID, would they still benefit from getting the vaccine?
And I think this relates to your question a moment ago. Since we do not know how long in a protection lasts following infection or following vaccination, the recommendation is that if you have been infected with SARS-CoV-2 and a vaccine becomes available to you, that you should get the vaccine.
And do we know yet if a vaccinated person can transmit the SARS-CoV-2 virus to others?
It is possible that that's the case. We don't know. We know for sure that when you get vaccinated, you have a 94 to 95% protection against clinically recognizable disease and certainly against severe disease. What we don't know is that you could be protected from disease but still get infected. You don't have any symptoms, but the level of virus in your nasopharynx might be, and I say might, be enough to transmit to other people, which means that even though you get vaccinated and you're protected, it is likely for a considerable period of time, we still would recommend wearing a mask to prevent you from infecting someone else.
Great. So until there's more conclusive research on this, we should still continue to practice the 3 W's. And the 3 W's are washing your hands, wearing your mask, and watching your distance. And similarly, along those lines, should people who have had COVID-19 continue to practice the 3 W's?
Oh, absolutely. I mean, I don't think anything we're intervening, anything that happens, we should not completely abandon public health measures. Hopefully, when we get enough people vaccinated, let's say 75 to 85% of the population, and the level of virus is so vanishingly low in society that the chances of getting infected are minuscule, then you could start pulling back on the public health measures that we've been recommending.
So many people in the communities are thinking about waiting because they've heard of this term called herd immunity. Can you talk about or explain why that's a bad idea?
Well, it's a bad idea because if enough people wait to get vaccinated, you're never going to reach herd immunity. That's the wrong approach. Herd immunity is when everybody recognizes that we are in this together and we will get out of it together. And being together means both adhering to public health measures as well as getting vaccinated.
So we talked a little bit earlier about the American Indian and Alaskan Native communities having greater incidence of underlying health conditions, such as cancer, diabetes, heart conditions, respiratory issues. So can you tell us, are these vaccines safe for those individuals in our communities?
We have included in the clinical trial people with underlying conditions that are stable. We feel that in those people, the vaccine is safe and effective. If someone is in a compromised immune system, either by chemotherapy for a cancer or an autoimmune disease, we know that it likely will be very safe. We're not sure if it will be as effective as in a person with a normal immune system. But we will find that out as we get to vaccinate millions of people.
Great. In tribal communities, there is a tremendous emphasis on looking out for our future generations, the 7 generations concept to be exact. Has there been any research about whether the vaccines could negatively impact women of childbearing age or their future children?
These testing in women who are pregnant, we have tested these vaccines in women of childbearing age, some of which have bore children. And the fact is, there's no evidence that there's any negative effect on those individuals. We have not explicitly tested it in women who are going into the trial being pregnant. But if you look at the history of vaccinology, vaccines have not negatively impacted pregnant women in a very large experience with most vaccines, particularly vaccines that are not live attenuated. You don't want to give a vaccine to a pregnant woman that's live attenuated, but this is not a live attenuated vaccine. This is a pure induction of a protein by the messenger RNA.
Excellent. So with all the information circulating around, where can tribal communities go to find the most up-to-date and accurate news and information about COVID-19, including general health tips and other information?
I think if you go to the CDC website, cdc.gov, go to the search box and do COVID-19, and just about everything you want to know about COVID-19 will be there. If you want to learn about the possibility of being on a trial, you could put it on to covidpreventionnetwork.gov or go to the NIH website, nih.gov, and go COVID vaccine, and it'll come right up on the screen.
Perfect. And so what would you say are the most important things that tribal communities should consider to help protect and preserve their elderly populations as we get closer to having available vaccines across the country?
I believe strongly that adherence to the fundamental public health measures of what you mentioned, wearing a mask uniformly and universally, avoiding close contact, keep your distance, stay away from congregate settings in crowds, particularly indoors, and washing your hands as frequently as possible will go a long way to protect your community, including your elders and those with underlying conditions. As soon as a vaccine becomes available to you and the tribal nations, you should very seriously consider getting vaccinated. It is an extraordinarily effective form of prevention of this particular disease and other diseases for which we've been very successful with vaccines.
So Dr. Fauci, we have packed a lot of highly useful information in our very short conversation today. With all of this critically important work that you're doing every single day to get our communities, our country to a better and safer place, we want to thank you for talking with us today, answering all of these questions and that have been on the minds of many, many across the country. We also want to thank the viewers who have joined us today. In a prior event, Dr. Fauci shared with us his passion for basketball. And so I wanted to, in those terms, share something that I believe right now we are in double overtime, meaning that no one can substitute for us. We know we are all exhausted, but every one of us individually really needs to step up and do our part to protect our families, to protect our communities and our cultures. Native peoples are very strong, extremely resilient, and I believe armed with the current knowledge about this virus and the unfolding steps to overcome it, I know that we will. So again, I wanted to thank Dr. Fauci for his time, and goodbye, everybody.
Thank you.